Welcome back to The Link, everybody. We have an extra special episode of Hafa Health, our segment where we teach you how to live a healthy and happy island lifestyle here with our friends at FHP. And we are talking about understanding health of the gums and of the teeth and everything that has to do when you see the dentist. Of course, that is an essential part of taking care of yourself. So we welcome into the KOM News Zoom room for the very first time a friend of ours, someone who is an expert in this topic, Dr. Jurga Martini. Doctor, happy holidays to you, and welcome to the show.
Happy holidays, Jason, and thank you for having me.
Okay, and I guess to set up a little bit of context, this doc, I spent a pretty substantial part of my youth at the dentist office. I had 9 teeth pulled by the time I was 11 years old. I wore braces for 3 years. I had constant cleanings and everything like that. My parents actually really emphasized good oral hygiene and making sure that I brush my teeth. Ask my coworkers here, I brush my teeth 4 times a day. But I really try and get it done. And yet I know there's more I could do and there's more I could understand. So that's why we brought you onto the show about a variety of topics dealing with good dental health.
Great.
Okay, so how, even as obsessive and maybe a little bit OCD as I am with, taking care of my choppers and everything, how often should I, and should the average person out there, how often should we see people in your profession regularly?
Recommendation is twice a year, but at least once a year is just like a physical medical exam. We would like to see patients at least once a year.
Okay. Does that include because I mean, when I think of, cleanings and everything like that, that's kind of just, routine. You go in there, yeah, maybe I've had coffee a few times, I drank tea, so there's a couple stains that need to be touched up and everything. Or should I get basically an entire workup, x-rays, taking a look if my teeth have shifted, what happened with my wisdom teeth and everything like that. Is that what I should be doing twice a year?
So recommendations are to get full set of x-rays or a panoramic x-ray every 3 to 5 years, most of the cases every 3 years. Mm-hmm. And once a year we update to what we call bite ring x-rays, so we can see any early changes in cavities and bone loss. On the yearly exam, we do a thorough examination of your gums, measure the gum pockets, check again bone levels, look for any restorations, fillings, crowns that are deteriorating, need to be replaced. We can see a lot of things like a lot of people are not aware they're grinding and clenching, so we see changes in the enamel, breaking of the enamel, cracks in the teeth. We can recommend crowns, we can recommend knife guards, all kinds of things. So it's not just a cleaning to remove the stains, we inspect and look actively for a lot of things, a lot of changes.
Right. Now, as I understand it, doctor, from talking, to various dentists as I have over the years, apparently Guam has a kind of alarmingly high amount of tooth decay and periodontal disease when it comes to the gums. And somebody told me once, and they said, as we age, obviously, with men, sometimes you get a receding hairline. Your gums aren't necessarily supposed to naturally recede the older you get and everything like that. If you see that happening, that means you probably got something that you got to go see your dentist about.
2 interesting topics that you touched. Yes, since I recently moved to Guam, I noticed very high caries rate among children and adults. Those things we can work together, keep you healthy. As far as periodontal disease, it's again very prevalent here on the island, and it's recession as well as things we don't see and we don't feel. It's deep pockets around your roots, bone loss, and most of the cases patients are not even aware that there is major things going on. So again, regular healthcare, regular appointments, x-rays, we can detect that early.
Now, would your intuition as a physician, as well as as the patients that you've seen, does that normally indicate that it's people not brushing their teeth enough, or even if they do so 3 times a day, they're just going in there and doing the 20-second thing, and then they're in, they're out. I mean, you should actually dedicate at least 1.5 minutes to brushing your teeth every time, right?
At least 2 minutes, and we always encourage to use an electric toothbrush, and they have built-in timer. It's a lot of factors that will contribute to that. Brushing and regular appointments is one thing. Then again, how your body responds to plaque and bacteria in your mouth. Mm-hmm. And Some people are good brushers and they still end up with some gum inflammation and bone loss. Some people don't do that of a thorough job and are okay. So again, genetics is involved in that as well. So when patients come in, we can customize treatment. Sometimes lots of things, even clenching, grinding teeth can contribute to gum recession. So again, we need to customize treatment for each patient and identify what are the factors causing this.
Oh yeah, doctor. I mean, I've owned a Sonicare for so long. I should probably have stock in the company at this point and everything. But that is one of my most prized material possessions. I love my Sonicare.
Great.
It really gives me a feeling like I've just seen you. Like, you know, every time I brush my teeth, it's like, wow, my gums feel great. You know, like it's nice and smooth and everything. Like it's a wonderful tool. But of course, the one thing that always comes up, and your dentist will always ask you this, is do you floss? And most people universally agree that that is really, really important to do. But then most people, in my experience, you know, don't really commit to doing that on a regular schedule. Like, how much does not flossing regularly and the right way contribute to periodontal disease?
Well, when I talk to patients, I explain to them you can be the best brusher on the planet and have the fanciest toothbrush, but there are two surfaces in between the teeth that never get cleaned. So that's where the floss comes in handy. And now we have lots of aids available to clean besides the floss, all kinds of interproximal, what we call rubbery things, and floss holders. So people who sometimes don't have good manual dexterity to get the floss all the way in the back, there are a bunch of things we can recommend. We can go to Kmart here and buy it. They're just not aware that it will be as good of a job as flossing.
Exactly. And I'm glad you brought that up because if you go to any store, you know, people go by, you know, the oral health section and they're like, oh, okay, well, I know, you know, I could get the electric toothbrush or, you know, I can get a bunch of disposable toothbrushes and maybe there's the dental picks because that's helpful. And then people say, you know, should I actually buy a separate bottle of fluoride or should I buy like the combination, you know, toothpaste where it says whitens your teeth, freshens your breath, you know, gets the plaque out and everything like that, and they want to maybe save a few bucks or, you know, consolidate and everything like that. I'm sure you would agree that like actually getting a dedicated fluoride product and rinsing and swishing and everything like that, you know, like you put in, spend a couple extra bucks, put in the extra work, it is going to pay dividends as time goes on.
Definitely. Most of the toothpaste products on the market, they have fluoride, the levels approved by American Dental Association. Mm-hmm. However, as we're aware, there's a high caries rate on the island. And when we think about it, there's lack of fluoridation in the water. People drink filtered water. And again, we talked with FHP team, what can we do to get our patients as healthy as possible and keep them as healthy as possible. So as far as decay rates, we offer fluoride treatments twice during your regular cleanings twice a year. Mm-hmm. But then for some patients, we end up prescribing the specialized higher concentration fluoride toothpaste as prescription only. Some patients, we recommend higher concentration fluoride rinse is over the counter. So again, that's why regular exams come in handy because we can customize.
Yeah, and again, walking in any store, I mean, I've got like literally 5 million different combinations and, you know, and brands and chemicals and, you know, combinations of things. I've always been curious about hydrogen peroxide and whether that should be like is it an impulse buy? Is it a luxury item? Or is that something I should really prioritize as far as my oral health goes?
Hydrogen peroxide is usually not recommended. It's too harsh. It's going to do more harm than good. So if patients have periodontal disease, we give a prescription chlorhexidine rinse. Over the counter, we always recommend to use any mouth rinses that don't contain alcohol. Like, for example, patients who have dry mouth or are going through chemotherapy or have medication that cause dry mouth. There's a line of products that we can get over the counter. For some patients, they say, oh, I like the strong Listerine taste. I feel like it's cleaning well. Well, they can stick to their Listerine, but shouldn't use the one with alcohol in it. It's, again, too harsh for your gums and for your soft tissues in your mouth.
And obviously one thing that we see, doctor, is a lot of people want to buy like those tooth whitening products because it says, you know, it'll get your teeth 19 shades whiter in only 6 weeks, but they're doing this for cosmetic appeal, but they're not necessarily doing it for health reasons. So, you know, they open their mouth, you know, 2 months later and they've got a smile that could light up Tumon Bay. and yet they've probably still got, cavities and like things like that. So how do you recommend your patients, when they say, I really want to have a white, the whitest teeth possible because I'm an Instagram model and everything like that, but you also got to take care of, your teeth, your gums too.
That's right. When people want to do teeth whitening, again, like you said, we need to evaluate if there are any cavities and underlying issues before we do teeth whitening in the office or recommend something over the counter, because again, lots of variations. They might not get as good results if they have some old fillings or crowns or whatnot. Again, depending upon the structure of the enamel, for some people, too much whitening might not be good long term. For some patients with really strong enamel, they're okay on doing it more frequently. Also, there are some toothpaste over the counter that really do a fantastic job just maintaining your whitening results after whitening. So again, every patient is different, enamel structure is different, so that's what we need to look at and advise them.
Okay, good to know. Well, you mentioned X-rays a few moments ago and everything, and I want to kind of talk about that for a moment, if I may. How many X-rays should I be getting? And even though I see a dentist like yourself twice a year, how many X-rays do they have to take? And do my teeth, will they really have that much significant movement? Twice a year?
So we take full set of X-rays. Excuse me. Once every 3 years. Either a full set will be small set of small X-rays, or a big panoramic X-ray and a few in the back. And then once a year we update only the what we call bite wing X-rays in the back and a couple in the front. So we try to keep the radiation dose as little as possible, as whatever is needed. So we don't just go and zap X-rays on patients just to make our life easier to diagnose things. We have to customize for some patients.
Okay, and I may be weird. I may be, kind of like the outlier here, but actually getting X-rays of my mouth is my favorite part of seeing the dentist. I don't know what. Maybe it's because they put that big vest and it makes me like real warm and everything like that, or maybe because I want to be an Instagram model. I just feel like somebody else is taking pictures of me, but Forgive me. I know vanity is a sin, but that's one of the reasons I go to the dentist so often. I want to have a good mouth. My mother has literally spent like $10,000 on my teeth over the years, but
Wonderful.
yeah, that's another interview. Okay, may I ask you to dispel a myth now, doctor? When it comes to brushing the tongue, you go online and you see a whole bunch of stuff. People say it's an absolutely essential thing that you have to do to have perfect oral health. Some people say it's an old wives' tale. That's it's not really necessary, or like somebody made it up years ago just to sell product and everything. But what do you recommend as far as brushing the tongue?
I'm a big believer in brushing the tongue. Again, every patient is different. Some patients, when we do a yearly exam, you can see their tongues are white and coated, and some people looks like baby's tongue, nothing on it. It depends upon the anatomy, and they have like hair-like things growing. For some people, they're longer. For some people, shorter on the tongue. And the long ones obviously trap plaque and bacteria. So brushing the tongue with a toothbrush doesn't do as good of a job. I always encourage patients to get a tongue scraper. You just rinse it and reuse. It removes a lot more plaque. And I tell patients this is some of the food particles, bacteria just sit there and rot on your tongue, and you can be really thorough about brushing and flossing. You still have source of bad breath and potentially infection spreading eventually sitting on your tongue. Yeah, tongue scraper is a really good thing to use. But again, for some people, they can scrape the tongue and not much will come out.
Mm-hmm. And should this be part of my normal teeth brushing routine? Like if I brush my teeth after every meal, I should also scrape my tongue after every meal?
So once a day.
Okay.
I would recommend to do it at night, in the evening, so plaque doesn't sit there, because at night the tongue doesn't move much, salivary flow is not as good. So yeah, I personally do it myself in the morning. That's my habit. As long as you do it consistently, you're doing really great service to your general health.
You take care of your mouth, and your mouth takes care of you. As simple as that. Okay. Now, before I let you go, Doc, I have one final question because you were mentioning, kind of like things that might be like a little bit gross or like, like a bad breath and it stinks. I've noticed that as I've gotten older, because I'm 47 right now. A few times over the years, I've developed, and I've had to look it up online, but tonsil stones, and you get like these little nasty little like kind of like white bulbous things that sometimes pop out. They just sit in the back of your throat for a few days before they come out naturally. If I have that, and I mean, the smell could wake the dead. I mean, obviously, like I'm preaching to the choir here, but they can be rather, at minimum, a little bit inconveniencing. At worst, they can just, give you some pretty funky breath, right? If I have an issue with this, should I see yourself as a dentist? Should I see like, my normal family doctor? Or, how should I address that?
That would be either your family doctor or ear, nose, and throat doctor.
Okay, the ENT. Gotcha.
Yeah, ENT. Those stones are harmless. Occasionally they can get infected. Again, some patients have deeper grooves in the tonsils, and that's why you end up with those tonsil stones. So, your family doctor.
Okay.
Or ENT.
Okay, well, Doc, we'd like to extend to you the final word because, of course, holidays are coming up, and typically a time when people eat a lot of food. They drink a lot of eggnog, a lot of, cider, if you will. They eat a lot of holiday candy and everything like that. So as a professional, someone who has dedicated her life to making sure that everyone has the cleanest and healthiest mouth possible and everything like that, what should we know about good oral hygiene through the holidays?
It's the same thing when I talk to patients about drinking sodas all day long. It's your decision if you're going to drink eggnogs and then all kinds of sweet and good stuff. Don't just sip it all day or have a can on your desk and keep sipping, because sugar gets broken into acids in about 20 minutes. So 20 minutes later, we take another sip. Now we're bathing the teeth that got affected by acid, we're bathing them in sugar. So I tell the patients, drink the whole can, rinse your mouth with water after that. No damage done, no damage dentally. So if all the sweet stuff is going to come now during the holidays, just make sure you don't let it sit on your teeth. Just rinse it.
All right. Well, thank you. Thank you for the insight and the expertise, Doctor. We really, really appreciate it, Dr. Jurga Martini over at FHP. And remember, everybody, ask for a Sonicare. Ask Santa for a Sonicare. That's going to be the best present you ever got. I am testament to that. So, Doctor, we extend our happiest of holiday wishes to you and your team and your family over there at FHP.
Thank you, Jason. Same to you guys.
All right. Have a wonderful day. And please stay tuned, everybody, because the link will continue with more right after this.
We all know that a healthy lifestyle is important to prevent chronic diseases and long-term illnesses and boost mental health. It's difficult to determine exactly which healthy habits are worth investing in to live longer and healthier lives. But FHP is here to help. Tune into the link every Tuesday for FHP Hafa Health Tips, brought to you by Take Care. Helpful advice about healthy lifestyle choices that will have a big difference in your health from the medical experts at FHP Clinic. FHP Hafa Health Tips on the link every Tuesday is brought to you by Take Care.
Uno Mixed. We're mixing it up on the last Thursday of every month with a look at lifestyle, entertainment, food, and so much more on the stations, networks, and digital platforms of KUAM Communications.
Uno Mixed is presented to you by Docomo Pacific, Better Together, and Pepsi. That's